nearly 70% of COVID-19 patients being treated in intensive care not vaccinated against the disease, and we are seeing a rise in cases again. How concerned are you? What's happening?
Morning, Shane. Yeah, I think up the last 4 days we've certainly seen rise in cases somewhere between 1,500 and 2,000 per day. Now, we are in a much different position when we see that we have 92% of the adult population fully vaccinated and about almost 90% of those over 12 fully vaccinated. So it's not necessarily just a measure of caseloads on the day. But having said that, what we have seen significantly is a rise of about 23% of those in hospital. So with COVID, so as of last night, I don't have this morning's figures, but as of last night, 393 people in hospital and 74 in ICU. And as you've said, 67% of people in ICU today have had no vaccination and 3% have been partially vaccinated. So still a real call to those people who have not come forward yet for vaccination to please come forward. And we've always said no one be left behind.
Just in terms of the vaccination programme, which has obviously been hugely successful, has it kind of dropped down to a trickle at this stage, or are there people still coming in to get vaccinated in large numbers? Or do you think we're at the point where pretty much everyone who's going to get the vaccine at this point has got it?
Yeah, well, first of all, I think, yes, we are certainly up there world leaders in terms of the uptake in Ireland. Much talked about across the EU and the world, the uptake we have here. Having said that, we're still very focused to encourage more people coming through. And we have a number of initiatives. So you've probably seen some of the initiatives with students in colleges. We have on-site vaccination clinics and centres all across the country. We're still working with some of the vulnerable populations and some of the not-for-profit organisations who would work with those. So we're still working to encourage as much possible as we can come through. But yes, we are a very strong uptake. I was in a vaccination centre last Friday, actually, and it's quite encouraging to see all ages sitting there just waiting to go through the queue to be vaccinated. And so we're still seeing people coming through, and we still want to see some more people coming through.
Are you surprised that we still have relatively high numbers in ICU? I know they're nothing like the peak of last spring, but I mean 74 in ICU at a time when such a high proportion of the population are vaccinated.
Yes, I mean it is a concern for us because we do know that any patient, whether it's in a hospital bed or in ICU, COVID patients have a disproportionate effect on the impact on our hospital system because we have to isolate. Sometimes we have to create dedicated wards. So it does impact on our capacity quite disproportionately. So yes, it is a concern for us in any numbers. Now, having said that, certainly we are not up at levels where we were in January of this year of 220 people with COVID in ICU. But the numbers have stayed very steady now between 350 and now rising very close to 400, which is something we would like to see coming down, particularly as we head into winter.
Well, you talk about...
Sorry, Shane, very briefly, just on the age profile. If you see the age profile of what we have in ICU, even at the moment today, 58% are over the age of 50, but 40% are in the age bracket of 15 to 49, so a high proportion of people not vaccinated and across all age groups. So okay. It really is a call, if you're not vaccinated, you are at higher risk of getting sick and potentially being in ICU. If you're not vaccinated, you have a higher risk of transmitting the virus too. So real important call for people to come through.
Okay, you mentioned the coming winter. I imagine a lot of pressure on your services, given COVID, given waiting lists, given the cyber attack. Will you be able to cope this winter? Will the service be able to cope?
Yeah, very significant. It is going to be a difficult winter, and you can see some of the pressures on our staff. Many of them are exhausted. 4 waves of COVID and a cyber attack. Having said that, we're putting in a number of initiatives throughout winter funded by government again this year to support the hospital system. So sometimes a lot of supports that we need to put in for the hospital system are outside in our community. So a lot of more initiatives again about keeping people safer at home and putting some clinics outside of the hospitals, even outpatients lists not being done in the hospital, in the community. Community intervention teams that we will have in place throughout winter, kind of multidisciplinary teams working to give people care at home. And then a number of initiatives indeed in the hospital to try create more capacity as we head through the winter. So it's going to be very challenging, and at the same time what we want to do is stop the growth in the waiting list and to start make some initial impact as well on the short-term plan we have.
As part of that, those long waiting lists, you're in talks with private hospitals to try and reduce that. Tell us a little bit about that.
Yeah, we have a number of initiatives, one of which does involve the support from the private hospitals. We do have a procurement arrangement, and right now, every week for the last few weeks and for the next few weeks, we take up about 1,000 bed days per week from the private system to support us in non-COVID care that needs to be, that help us support us in doing it. So that's one aspect of it. A second aspect of our short-term plan is to put in some extra capacity in the public system, so some extra hours for our theatres, out-of-hours clinics that we will seek to be doing between now and the year end. And we'll also be working with the NTPF and trying to prioritise some of the capacity that they would take up in the private system too. So it's a combination of utilising some capacity in the private, increasing some capacity in our public system, and working with the National Treatment Purchase Fund on some priorities, particularly around those longer waiting on the lists.
Okay, two quick things before we let you go, Paul. The new Sláinte Care Programme Board has been established. You're co-chairing that with Robert Watt, the Secretary General of the Department of Health. When are you hoping to get up and running on that, and are you hopeful that Sláinte Care can be implemented?
Yes, I mean, it's the reason I took up this job 2 years ago, was to implement all aspects of Sláinte Care. We're not waiting to start. Right now, today, we're implementing many initiatives that are part of Sláinte Care, some of which are just listed there as part of the winter plan, but strengthening capacity in the community. The other big aspects that you just referenced relate to looking at regionalisation and also putting in a multi-annual long-term plan to address waiting lists. And then some major e-health initiatives. So we will be working on those and are relentlessly working on those, and we want to see more aspects of those being implemented throughout 2022 and indeed into the following year. So it'll be a multi-annual plan. Myself and Robert have commenced that process with our teams already.